I think race equality has gone a long way since we first started in terms of the organisation, for instance, and a lot of changes have happened. But I also have to say that despite a lot of the positive changes, we're still having issues in relation to the way in which, for instance, unemployment or poverty disproportionately impacts on the black and minority ethnic communities. And although there's been changes with that, things are still not as we would like them. And I also guess that the riots that happened earlier on this year and the response to the riots in some ways raises a question about how race equality is addressed by those in power. Social work I know social work's one of the areas where race equality has been on the agenda for a huge number of years. So much so that in relation to social work training, it's an integral part of social work training, and social work itself has been addressing issues such as issues in relation to the placement needs, for instance, of black and minority ethnic children, which has progressed quite a lot, and we are in the main placing black and minority ethnic children in black and minority ethnic substitute homes. But the other side of that is there's always been and continues to be a backlash against that, and every so often we will get people getting really worked up about the fact that black children apparently are languishing in care, and then there's a huge numbers of adopters who can take them, and presumably here we are talking about white adopters. So the discussion gets skewed in that way. So I think there's been positive changes, but there's always a negative impact on this.
Okay.
What I'm hoping for in relation to 2012 relates to health. And the reason why I'm saying it is because some of the involvement I have had over the year around health. And it's really to do with the government's agenda around the public's health and improving the public's health. And for me, given what we know in relation to health inequalities relating to black and minority ethnic communities, I'm hoping the agenda, both in relation to the NHS, but also in relation to the local authorities, around improving the public's health, will take on board the inequalities that exist in relation to health and then try and make improvements. And I'm hopeful, because of some of the changes that have happened and the way in which it appears that the health service is beginning to take on board some of the issues around health inequalities, that I'm hoping that the public's health in relation to 2012 onwards, in relation to black and minority and ethnic communities, that there will be an improvement.